This is Dr. Zorba, pastor, with a rapid health brief update concerning RFK's recent guidelines talking about antidepressants and new federal initiatives. So, first of all, let's get a bit of history about antidepressants before I go into it, because some of the things they're suggesting are good and some of them are rubbish. So, antidepressants were first developed in 1957. That's a long time ago. They were called tricyclic antidepressants. They were not really embraced by psychiatrists for 10 years because they thought everyone should simply have psychoanalysis. Of course, who could have afforded psychoanalysis except for upper middle class people? Certainly not people on the street. But anyway, getting back to antidepressants. Tricyclics, good drugs with side effects, dry mouth, difficulty urinating sometimes. And so they were used. There were different tricyclics around, but they weren't embraced dramatically. And then in 1987, a major step forward, Prozac was released. And Prozac changed lives. It really changed lives. Eli developed this drug. It's a group of drugs called SSRI, antidepressants. Prozac, Zoloft, Celexa, Lexapro are all in this class. And these drugs are really quite good. Do they have side effects? Oh, of course they have side effects. The most common side effect in SSRI drugs is that they can affect sexual function. In men and in women, they can reduce the ability to actually have an orgasm. And that's one of the common reasons, especially that young people stop taking them. But let me be clear up front. We've always known that these drugs can have side effects. Dizziness for some people, flu-like symptoms for other, insomnia, anxiety, restlessness. Some people say they have brain zaps. These are significant drugs that shouldn't be taken willy-nilly. We know they have side effects. And when you go to the pharmacy, you'll get a printout of all the side effects if you have them. And if you have questions, you talk to your doctor. You may change antidepressants. You may stop them completely. And in fact, if you look at the number of people who are given antidepressants, and some studies have shown 30 to 40% stop them, often within about 2 or 3 months. A fair number, either because of side effects or they feel better or they simply no longer take them. But other people stay on these antidepressants and they work really well. Now, these federal guidelines are kind of interesting. So first of all, how much do doctors pay attention to federal guidelines? Well, I didn't even know there were federal guidelines. That's how much I paid attention. And I've been in practice for 45 years, more than 45 years now, and I'm still in practice. But sometimes we look at federal guidelines. We really look at guidelines of our own, the own organizations we belong to. In my case, the American Academy of Family Practice and so on. And I also look at guidelines that are written in important medical texts like Up to Date. And Up to Date is a text that's reviewed every 6 months, and it has to be rewritten every year. And it sort of gives us guidelines on who should stay on these and who should not stay on these. But getting back to RFK's idea, he thinks people should go off these things. Come on. He thinks exercise should work. Okay, I agree with that. Getting more sleep should work. Okay, I agree with that. Nutrition should work. Well, I think everyone should be on a Mediterranean diet. Social connection, of course it works. If you're depressed, what are you going to do? Sometimes you don't have friends. Stress reduction, great idea. Mindfulness, excellent idea. Finding purpose in your life, of course. And you want to be part of your community. These are all great ideas. Not easy for people who are depressed. Now, when it comes to therapy, it's rather interesting. First of all, I think of depression as 3 things. Third of people are helped with therapy. Third of the people, or more, 2/3 are helped with antidepressants. And a number need both. That's a great idea. Try to get into a therapist. You might get into one. You might find out one you like, but it might not be covered by your health insurance. So antidepressants are often prescribed and they really work. And some antidepressants are overprescribed in time. So here's what I think. I think the idea behind federal guidelines is good, But antidepressants are wonderful. And we have to remember that in England, they stopped antidepressants roughly in the year 2000 because they were worried about young people actually committing suicide because they were on antidepressants. Basically, the government gave some updates. They stopped them. And then 2 years later, they recommended putting them on because people had more suicides when they were taken off of antidepressants. So here's the bottom line. You should look at whether or not, if you're on an antidepressant, whether or not it's useful for you. And then with your clinician, if you decide you're going to get up, determine the proper tapering schedule. I think it's a great idea. I think it's excellent. And a number of people don't have to be on it who still are on it, but a number of people have to stay on that antidepressant. And the whole issue with RFK and this whole movement is really to put up a screen and go, oh, these drugs are really bad. They're really not good for us. We should stop. But in reality, these drugs have made a major change in people's lives. If you remember, if you're older like me, and you remember some people were put into the hospital for, quote, a nervous breakdown. Most of those people had severe anxiety and had severe depression that often produced catatonic behavior. And they were in the hospital. Some of them were given shock therapy. A number of them had to stay in the hospital for 2 weeks to 2 months. And that's because antidepressants that were good were not around. And since we've had them, these drugs are a major step forward. So my recommendation is you should look at whether or not you need to have an antidepressant or stay on one with your clinician. There's nothing like a one-to-one interaction. This is Dr. Zorba Pastor saying, stay well.